It's a routine non-invasive screening procedure for cervical cancer in women. As you know, cervical cancer is among the most common gynecologic malignancies in women. The procedure involves collecting cells from cervix of uterus by using a spatula and an endocervical brush, and then collected cells are examined under a microscope if they are abnormal or not. And abnormal means that if they are precancerous or cancer cells. These cells should be obtained from the external surface of cervix, which is called ectocervix, and also endocervical canal, which shows transformation zone. This area at greatest risk for neoplasia, and we have two methods. One of them is collecting cells by a brush and smearing the cells onto a glass slide. This is called the conventional method. The second method is called liquid-based cytology. In that method, the collected cells on the brush are washed into a preservative solution, then filtered. Filtered sample is presented in a thin layer on a glass slide. This technique improves the specimen adequacy and also detection of precancerous lesions. And as you know, the primary cause of the cervical cancer is human papillomavirus. This latter technique has also the advantage of showing low risk and high risk HPV by looking at HPV's DNA. Terminology for reporting cervical cytology was determined by Bethesda in 1988, and this system has been revised several times. The current system was developed in 2014. HPV testing was also incorporated this screening system. The detection of specimen adequacy is really important. The cells should be evaluated if there are any abnormal epithelial changes, and we use general histomorphologic cytologic criteria in terms of nuclear and cytoplasmic changes in the cells to determine the abnormality of cells, to determine the cancer cells. We classify the results by using Bethesda system. We classify them into several categories, starting with atypical cells of undetermined significance to cancer. So we have several categories, and these changes indicate HPV infection and also possible malignancy potential of the patient. In the presence of abnormal Pap smear results and or high risk HPV positivity, endocervical canal sampling is performed. It is a technique which is performed with colposcopy to get a biopsy for diagnosis of cervical cancer. And then we diagnose the tissue into several categories. For example, we can diagnose the tissue as a low-grade malignancy, intraepithelial lesion, or a high-grade lesion in terms of precancerous or premalignant features, and we may also diagnose in situ carcinoma, and we may diagnose invasive carcinoma, which means that the tumor tends to go to the deeper tissues. And this diagnosis will guide us in the treatment of patient.
Thank you very much, Hocam.
You're welcome.